Hello, and Namaste Ji to my large Indian population who follows me. My name is Dr. Hillel Mazansky, and I'm a board certified physician who specializes in medical hypnosis, guided imagery, nutrition, and exercise. Over the last few weeks, I've received numerous emails and telephone requests to explain exactly what happens during a session of medical hypnosis and guided imagery. And I thought this would be a good subject to discuss. First of all, my specialty is medical hypnosis, guided imagery, nutrition, and exercise. My website being www.gianinc.com, guided imagery and nutrition incorporated.com. What is medical hypnosis and guided imagery? I think the nomenclature needs to be classified. First of all, one has a hypnotist. A hypnotist is usually an entertainer who so-called hypnotizes people at events, and this type of hypnosis is really contrived. Then we have hypnotherapists. These are professionals who have master's degrees and master's degrees in social work, or maybe even PhDs in psychology. Those are called hypnotherapists. If one is a physician, such as myself, with medical knowledge and medical practice behind me, I am termed a medical hypnotherapist. When one schedules an appointment, either in the office or telephonically, before the hypnosis begins, we take a complete history as far as past medical problems are concerned, physical and psychological, and then we give a detailed nutritional program that they are asked to adhere to, and a specifically designed exercise program. At the end, the patient is then asked either to lie down or sit down on the chair or on the couch. We prefer it if they lie down because they're able to relax more, to a greater detail, greater extent. Then we begin speaking. And hypnosis was first described in the late 1980s by a person by the name of Mesmer, hence the word mesmerize. And in a state of extreme relaxation, we tap into the subconscious, which often reveals the cause of the physical or psychological issue. The hypnosis session is divided into three. The first is what is called the induction stage. The induction stage consists of our instructing the patients how to relax completely. And once they are physically and psychologically relaxed, then the treatment stage begins. Questions are asked, answers are given, and at the completion, it is the return stage where they are, open quotes, brought back, close quotes, to the here and now. To every person that we've had the privilege of hypnotizing, they have enjoyed it beyond comprehension, because there is total physical and psychological relaxation. Guided imagery. What is the difference between guided imagery and medical hypnosis? Guided imagery is also known as visualization or guided meditation. The difference being is that in guided imagery, the patients are kept in a much lighter state of relaxation and are not relaxed to the extent that one does with medical hypnosis. We find, however, because we treat a large amount of people with medical conditions, that oftentimes it is better to do medical hypnosis rather than guided imagery. Other cases where we feel it is better to do guided imagery, they have a guided imagery session, and they're able to communicate easier when they have a guided imagery session. Not that they can't when they're deeply hypnotized, but in deep hypnosis, one is able to tap into the subconscious mind in a far better way. Not only do the patients come to us physically in our office, but also the technology exists now whereby patients are easily hypnotized or given guided imagery over the telephone. The advantage being is that there's no anxiety when they come to the doctor's office, and they can be treated in their own home. This is what medical hypnosis is. This is what guided imagery is. There is a whole host of medical conditions that one has that respond to medical hypnotherapy and guided imagery. Both forms of treatment are completely free of toxic side effects. It's a holistic mind-body treatment. In other words, the effect of the mind has on the body. And if we treat the mind, oftentimes the body improves. I think I have covered most of the information. If there is any further information, please feel free to email me at drhm@gianinc.com. Dr. Hillel Mazansky at gianinc.com. And I thank you for listening.